Hey guys, and welcome back to my channel. If you're new on this channel, my name is Silibaziso Mupereki, and on this channel I make everything to do with university life, nursing school and international student experiences. So if you'd be interested, definitely hit the subscribe button and join the family. So today's topic, as you can see from the title, is why I chose nursing. This is my personal opinion. You do not have to agree with everything that I'm going to be saying, but I hope it sort of encourages you to sort of continue doing nursing, because I know a lot of people get discouraged, especially when they're constantly being asked, why did you choose nursing? And I've definitely received that question a lot of times. So in this video, I'm just going to be giving you 12 reasons why I chose to do nursing. So first off, let's put a disclaimer. Please note that nursing and medicine, or being a doctor, they are completely different careers, and a nurse is not a step down to being a doctor, and a doctor is not an upgrade to nursing. They are different careers that are both essential and fundamental to the health system. I just chose the nursing model of teaching and how it functions over medicine, and one does not determine you doing the other. So just because I'm nursing does not mean that's my gateway into medicine, and I didn't choose medicine because I did not want, and not because nursing is subpar to medicine. So please do not ask me questions, why did you choose nursing, why not medicine, and that sort of thing. They are completely different things, and I just chose the one over the other, and I'll let you know in this video why I chose nursing and not medicine. So the first reason why I got into nursing is because of three aspects of my personality. The first one is I love helping people, and this love began in primary school when I started getting involved in community outreach, and it went into university and even high school. So I've just always loved helping people, and also because I love teaching and giving people information that they might not necessarily get in their normal circumstance. Hence, this channel also helps in that part of my life and what I enjoy doing. And the last reason is I love the human body. I find it fascinating. I think we were blessed with such an amazing body, and it's always so interesting to learn about it and just to see how it functions and how it heals itself and how we can help it to heal and that sort of thing. So I love all those aspects about my personality, and obviously I wanted a career that would allow me to merge all those three aspects, because I believe, a career that you're going to go into for life majority of the time is you need to love it, you need to be passionate about it, and I love all those different things about myself, and nursing was just a culmination of all those things. So that's why I was really excited to get into nursing. The second thing is I love the working hours. I know most people get very confused with how it works and that sort of thing. So on the screen, I'll just give you a template of how the whole system works. So it's a 2-week cycle. So let's say in the first week, I work a Monday and a Tuesday. Wednesday and Thursday I'm off, and then I work the weekend, which is Friday, Saturday, Sunday. Then the following week, the Monday and Tuesday, I don't work, and then I work Wednesday and Thursday, and then the whole weekend I'm off. So you can see in the first week I've worked for 5 days and I had 2 days off, and then in the second week I worked for 2 days and I had 5 days off. There's not many careers that offer that to you. And okay, let's say we're taking out the weekend because most people are off on a weekend. I'm still getting 3 days off in the second week. So as a result, nursing gives me that flexibility to be able to get involved in many other different things that I want to do, because obviously I don't think your career should consume you 24/7. There's different things that you can get involved in and extra hobbies that that bring purpose and fulfillment in your life, and I want to be able to have that flexibility. Yes, doctors do have some flexibility, but in the beginning of your career, or majority of your career, is majority of it you're spending working. They work 24, 36, 48-hour shifts, and sometimes they take their work home, and I do not want that. I really don't. So for me, I just want to be, when I go to work, I'm working and I'm leaving it at work and I'm going home and I'm in a different space and I don't want to constantly be thinking about work. Another thing why I didn't want to go into medicine is the on-call thing. I hate it so much. I really do not want to be at home enjoying my life, doing other things that are important to you. And you get a call, the patient, their blood pressure is spiking, they've got a high temperature, you have to order medications while on the phone, or sometimes you actually have to go in and check up on your patient. So for me, that way of how it functions for medicine was just a turn off for me, and that's why I loved nursing. After nursing, or after you graduate, students are placed into community service. Yes, I know international students don't form part of this, but for the majority is you get placed into a student facility, and at that facility, if there's permanent positions, you can actually get placed into them. So there's that job security. And also after you graduate, there's such a high demand for nurses within the country that you're studying, and abroad you have so many options of where you can get into. And that job security is really, really important, because you do not want to study something and then after you graduate you are unemployed for 3 years after having studied. So it's really important that I had that job security, that no matter where I went, if I decide to move overseas and that sort of thing, I'll always be able to use what I studied to further on my life and that sort of thing. Nursing is more hands-on. We are literally with our patients 24/7. The doctors, they come in, they check up on the patients, they give orders, and they move on, and they're dealing with so many patients the whole day that they really have time to have a conversation with your patients and to get to know them on a deep level. But majority of the time they are with us, and we get involved in emergencies, because if something happens we see it first. It's not like the doctor is passing by and says, oh, that patient has got a high temperature. No, we check that, because we're them constantly, and we get to talk to them and learn about their life and their emotions and that sort of thing. So I just loved how nursing is a bit more hands-on, and actually get more involved in the patient's life than just being a pass-by. And the next awesome thing is we save lives on a daily basis. Like, I feel like most people, when they think of nursing, they think all we do is change nappies and feed people and that sort of thing. And yes, that does happen, it's part of it, but that's not what we're doing majority of the time. Majority of the time we're checking if the patient's condition is deteriorating or it's improving. If it's deteriorating, what is going on, what can be changed. We interact with the multidisciplinary team, that's your physios, your doctors, and everyone else who works in the healthcare system, so that we work together to make the patient's condition better. We're making sure that they're having the right medication, that they go for the right treatments. We advocate for our patients, we educate them. There's so many different things that we are doing that are above and beyond just changing nappies. So I don't want people to think so low of us, because I think that's the name, or how the perception that people have of nurses is, we are just the servants of the doctors. No, we function independently on our own. We do completely different things from doctors, which are equally important as doctors' work. So it's very important that people realize that nursing is actually challenging. And for me, it's really interesting. I have a very inquisitive mind, and nursing allows me to do that, because we are constantly learning about different medications, different conditions, how to treat patients. And obviously the world is constantly evolving, and we have to bring those different ways of treating our patients, the advanced research that's going on, we have to bring it into the health system and introduce it and improve the way that we treat our patients. And actually this year, the vision for International Nurses Day is a vision for healthcare, which is more about re-looking at how the healthcare system is like, and how can nurses, since they are at the forefront of the healthcare system, how can we improve the policies that are there and the way we do things, be able to improve the care that we give our patients. So nurses are not just doormats and maids that are there for the patients, but we actually do very fundamental work, which is for the benefit of our patients. The next thing is we are committed to helping others. I strive to help as many people as possible. I believe my calling in this world is to help others, whether that's in the form of teaching or just being there and being that kind soul to someone, because being in the hospital is horrible. It's depressing because you're constantly seeing sick people all around you, and being able to be there to comfort people and to just make their lives easier is an amazing thing to be able to do on a daily basis, instead of a once-off thing with community outreach things and that sort of thing. So I absolutely love that about my career. Another reason why I love nursing is it's got a reasonable training time. 4 years, I'm able to get into the workforce. I'm able to start getting paid competitive pay straight after university. I did not want to study 7 years. So for all of you that have been asking, why didn't you go for medicine? I really don't want to be studying for majority of my youth. I want to be able to enjoy my life and be active instead of still be studying. Because honestly, guys, studying is exhausting. And I know a lot of people tell me, it'll go by quickly. You were just now in high school. You already finished in your third year. Yes, time moves fast, but it's still exhausting. It's depressing. University is stressful, and I really do not want to be doing it longer than I needed to. Another thing is, if I'd gone into medicine, I did not want to be just a general practitioner. I wanted to go further, whether that was going to be a cardiologist or a pediatrician. I wanted to go further with my studies. That was going to be about 10-12 years of me studying. I was gonna be 32 by the time I just enjoyed life, not having homework. I really did not want that. So for me, I love that after 4 years, I'm able to start working, I'm able to enjoy life, and didn't start doing other things, because I do want to start a family one day, and I still don't want to be studying while I'm having a family and that sort of thing. So I really just wanted something that is fulfilling, but I'll do it in the most shortest time possible. Another thing is, after 4 years, I'm registered as a registered nurse, so I can be a general nurse. I'll be a midwife, a community nurse, and psychiatric nurse. And I can branch into many other avenues, whether that's ICU, emergency, and that sort of thing. And it does not require me to have any extra training to get into all of those. I can literally change and switch up as I want, and I absolutely love that. Instead of other careers where you actually have to study an extra year and that sort of thing for you to be able to go into the different fields, I literally can move and learn as I go. Another really great thing about being a nurse is that you get insider secrets about the healthcare system. You know how it functions. If someone in your family or you've got a friend and they need a certain help in health and that sort of thing, you can actually recommend them to the best places to get the health, and sort of go around, take shortcuts, I guess I can put it in that way, and you don't have to go the long way. And there's a lot of insider secrets that many people actually are not aware of, and being inside of it, I can let people that are closest to me know how to best combat that and that sort of thing. So I love having those little secrets. Next thing is, nurses actually earn a really competitive salary. Unfortunately, yes, in the African continent, we are not there yet, and we're still pretty much really underpaid. But in countries overseas, you really can get paid a lot of money. I'll insert a picture over here. So as you can see, if you convert it to your own country's currency, you can see that it's a lot of money. So it gives nurses the options of being able to go out and experience other places and how nursing occurs in there, and actually getting paid really a great salary while you're doing it. Because yes, unfortunately in Africa, we do a lot for the healthcare system, but we are not paid out how much we actually deserve, and that is really unfortunate and sad. But there's always that option of going overseas, or if you really do not want to move from your own country you can open your practice. I think this is something that not many people know, is you can open your own nursing practice. Obviously you need to do a bit more postgraduate stuff to be able to get there, but that is an option for you. So don't always think that you must only work for a hospital or for a private practice and that sort of thing. You can actually open up your own personal practice. And then like now I'm seeing other people introducing a term known as nursepreneurship, which is pretty much nurses use your nursing skills to be able to do a side business, whether that's selling merchandise, that's selling nursing stuff, that's giving people free courses, educating others. YouTube is also part of that and that sort of thing. And because of our flexible hours, we do have the options to do that. So there's definitely many ways to be able to combat the terrible pay that we get. In addition to gaining insider secrets about the healthcare system, we actually gain very useful skills that we can take to the outside world, with our family, with our friends, and that sort of thing. And we can educate others. Like I mentioned, I love teaching, and nursing allows me to be able to do that. Whether you're holding seminars, whether you're holding talks, health talks, whether that's part of your community health nursing, or you're just doing it on a personal level and that sort of thing, we gain so many essential skills that I believe the general public needs to know. And we can use our role as nurses and very important healthcare personnel within the health system to be able to educate the public. So it's really important that nurses use their voice and teach others what they know, because we really know a lot, especially if you have had a lot of experience and you've been in nursing for a really long time. You really know a lot that can help others, and being a nurse, you're able to have that voice, able to educate others. So these are the reasons why I chose nursing. Definitely comment down below and let me know which one of these reasons were your favorite, and maybe you've got other reasons why you chose nursing and that sort of thing. I really would love to hear your comments. And this is all from me today. Until next week, Friday, 12 p.m. South African time, have an awesome semester. Bye guys.